Hi, my name is Amy and I am a first year midwifery student at Bangor University. Staff that are on hand with the midwifery course are absolutely fantastic. They are so supportive and they are so knowledgeable as well, and they're always willing to help in any way they can. Not only that, but I'm actually from North Wales and I used to work in the Bydwreigiaeth University Health Board, and because of that I was able to get a bit of a experience about the layout of the hospital and also work as a Red Robin on the maternity unit. So I was able to meet some of the staff that I hoped to be able to learn alongside if I got on. I think for me, placement is my favourite part of the course so far. I just love being in the hospital and in community, meeting different women and being able to be a part of their pregnancy and to advise and help them. I think it's just an amazing thing to be able to do things like being in the room when someone gives birth, because there's no describing the feeling of doing hands-on-hands deliveries or even just seeing the parents meet their baby for the first time. There is just no describing how amazing it is. I think it's amazing to be able to study at a university that is UNICEF baby friendly accredited. It's such an amazing thing to achieve, and the cohort a couple of years above me were the ones that actually put all the work in and managed to gain the accreditation, and I think that's just absolutely fantastic. I think a father's experience during pregnancy is it's quite a tough one, because they're watching their partner in all this pain and there's not really anything they can do. So I think it's really important to be able to show them ways that they can help, whether that be to rub their back, to give them encouraging words, and to be able to just be there for them. Making sure that a woman has a positive birthing experience is really important, I think, because it's something that she may only do once, but it's something that she will never ever forget, and because of that I think it's important that she's able to look back on it as a positive experience. And this can be done in so many different ways, and I think it's really important to involve the partner as well, because sometimes they can feel a little bit helpless, so involving them makes them look back in a positive way. And I think it's better to be able to involve the partner and have the partner be there holding her hand and giving her the encouragement, and there's just kind of stand back as a midwife and watch them support each other, because I think it's really important that they're doing it together and that it's something that they don't look back at it in a negative way. I think it's really important that they can look at it and think that it was a really positive experience and that they're not put off coming back in a few years' time and having another baby. And I think that it is a really important thing to be able to provide that care and that choice to make sure that the woman does have a really positive experience, because labours they can be very tough, and I think that giving them the degree of choice and that support can make a tough situation a little bit better, because they have a say in their care. And I think sometimes it's that say that they have that does make it a positive experience.